Hi, I'm Dr. Rachel Langley from here in beautiful Colorado Springs, Colorado, which here in the end of April is finally starting to look a little bit like spring, which is wonderful in so many ways. But for a lot of my allergy sufferers, it's nothing but bad news. So I thought I'd spend a little bit of time today talking about common over-the-counter medications that it can be used for allergies and which ones might work best for you. So let's start a little bit with what are seasonal allergies. So when your body is overreacting to something like pollen in the air or dust mites or anything that you're allergic to, your body releases a lot of histamine. Histamine is a chemical that was originally made by your body to attack big parasites like worms. Well, we don't have worms invading our body nearly as much as we used to back in the day. So now that histamine seems to have tried to find a job doing something else. So now it spends its time overreacting to things in the air that are not a threat to our health. The pollen that's out there is not going to make us sick, so it's just silly that the histamine comes out and makes us feel miserable trying to fight off that pollen. So, bummer. But what can we do about it in the meantime? So our body's already overreacting to these things. And based on the season, sometimes you can get an idea of what your body might be overreacting to. Here in Colorado, it tends to be in the early spring, late winter is when the trees tend to be releasing their pollen. So if you're getting symptoms around now here in Colorado, it might be a tree pollen allergy. Later in the spring to summer, it tends to be the grasses that are releasing pollen. Later in the summer to fall, it tends to be weeds. Or if you tend to get symptoms all year round, then it could be a combination of these, or it could be something like dust mites or animals that are causing your symptoms. Talking with your doctor, getting an allergy test to try to figure that out can be helpful. And you can consider injections for allergy treatment, which I talked about in another video. Maybe I can link to that, maybe not. But just scroll through this series on allergic processes for more information on that. But okay, so you know you've got allergies. The most common symptoms of allergies are drippy nose, red eyes, itchy eyes. Sometimes you'll even get hives in response to being exposed to a lot of the things that you're allergic to. Sometimes you'll have worsening of your asthma, and that can be life-threatening. So definitely a big reason to take allergies seriously, especially if you have asthma. But for typical patients, it's just runny nose and itchy nose, sneezing, red eyes. So these kinds of symptoms are the most common. And depending on what is the most bothersome kind of leads me to figure out what medications you should consider. So one of the easiest is if you just have red, itchy eyes and really no congestion, no sneezing, then I like to go straight to eye drops. So there you have antihistamine eye drops. So it's fighting that histamine that makes your eyes red and itchy. That's what the histamine chemical does, is make wherever it is red and itchy. So you're putting those drops directly in your eyes. It fights that histamine and it makes you feel a lot better. If you tend to get nasal symptoms, then I like the nasal sprays. So that can be anything from a saline, or a neti pot nasal saline rinse, or just a nasal saline spray to try to physically remove some of those pollen granules that get stuck on your mucosa in there when you take a deep breath. Just removing them, flushing them out can bring a lot of relief, especially if you do that right before bed. And then you can have nice clean sinuses overnight, be less congested. That can be really nice. Another really common one would be nasal steroids. So that'd be like Flonase, Nasonex kind of stuff, fluticasone. And those are a great treatment, especially for long term. Make sure to watch my video on how to give yourself a nasal spray properly. Steroids, if you use them all the time and use them improperly and are spraying towards the middle of your nose, you can actually develop a hole in the tissue between the two sides of your nose. It's not something terribly bad, but it's also not a great thing. I wouldn't recommend trying to get it. So avoid that thinning and atrophy of the tissue by making sure that you're administering the steroid nasal sprays, directing it towards the same eye on that side to avoid that. But what steroids do is they just force a decrease in the inflammation. So they don't combat the histamine. Instead, they just make everything stop swelling up. So that can really open up the passageways to your sinuses, as well as open up your passageways inside your nose so you can breathe better. Very effective, especially for the long term. And they can, sometimes with chronic allergies, you're blowing your nose all the time and you get these pouchings of tissue. The inside of your nose gets so traumatized from the constant blowing of your nose and sneezing that it starts to pouch outward and make what's called nasal polyps. And those will physically block your sinuses and your nasal cavity as well. So that's no good. And steroids administered via nasal spray are the #1 way to decrease the size of those polyps and maybe even get rid of them. So I've had patients that thought they'd have to have sinus surgery and cut those polyps out, which is not a comfortable procedure. It's a very uncomfortable recovery. And they've been able to avoid that by using steroids every day. So some people hate the idea of that and don't want to be on nasal steroids every day, but some people say, oh, if I can avoid a surgery by using this spray every day, heck yes, that's worth it to me. Then there's less common nasal sprays. There's cromolyn, which actually inhibits the mast cell. The mast cell is the cell that releases histamine. So it's supposed to inhibit the mast cell from releasing in the first place. So that's a good way to go. It tends to be not quite as effective as the nasal steroids though. So if the nasal steroids aren't quite cutting it and you want a little bit more, cromolyn would be a reasonable addition. And then there's antihistamines made specifically for your nose. And that can be a great option. It won't target the swelling or the polyps as much as the steroids will, but it can help with the itchiness. And I also, ipratropium is a possibility as well. That tends to be less for runny nose due to allergies and more for runny nose due to other things. Like some people just, whenever they exercise, they get a runny nose. Whenever they eat spicy food, they get a runny nose. Ipratropium is a great one for just cutting out the runny nose for the short term of those kinds of things. So if you had allergies and you said, oh man, I have awful allergies, my nose is running constantly and I just need a couple hours break for this job interview, something like that, then ipratropium would be a great nasal spray for that because it would give you a couple hours of relief for that job interview, date, what have you, but it wouldn't be a good long-term solution so much because you would have to be giving it so often. But often you have both itchy eyes and sneezing and runny nose all the time. So you want something that really affects more of your body. And that's where you get the typical allergy pills. Things like Zyrtec, Allegra, Claritin, Benadryl. Those are the classics. Those are all antihistamines that I just mentioned. So they developed antihistamines first. That would be your Benadryl and diphenhydramine. And they noticed that they made you really sleepy. So a side effect of those first generation antihistamines, which sometimes can be really nice. If you're having bad allergies and you're having trouble sleeping, a Benadryl is a perfect option. So they came out with a second generation of antihistamines, which tend to be less sedating. They make you less sleepy. And that would be your Zyrtec, Allegra, Claritin, fexofenadine, can't think of the cetirizine, and oh, how embarrassing. I can't remember the last name, generic name off the top of my head. But the generics are just as effective as the brand names and tend to be significantly cheaper. And those are fighting histamine through your whole body. And so it's going to help with the eyes. It's going to help with the nose. If you're getting hives, it'll help with that. And if you tend to have asthma, that can be a great adjunct to make sure that the seasonal allergies aren't going to make your asthma worse. If you also have asthma, montelukast or Singulair can also be helpful. Talk with your doctor about that one. And systemic steroids are kind of a last-ditch resort, whether that's an injected steroid or going on steroid pills for a couple days. There tend to be kind of serious side effects from being on steroids, but they do combat the inflammation in your whole body. So pros and cons, something you can't get those over the counter, so you have to talk with your doctor about those anyway. So hopefully if you're starting to experience symptoms that could be allergies, I know it can be hard to tell the difference between a cold and allergies, but especially if there's a lot of itchiness of your eyes or nose, I tend to lean towards treating allergies first. So give that a try. Use some of these over-the-counters depending on your symptoms. And then if things aren't getting better, by all means, come and talk to your doctor. Or if you're lucky enough to be a Pine Ridge Family Medicine patient, come in and talk to me. If you want to know more about different allergic processes, check out some of these videos right there. And be sure to subscribe to our channel in general to see more about your medical issues that might come up. Thank you for watching.